up? ADOS, FBA, BF1, B1, Urban Game Changers, CBAC, Triangle ADOS. Hey, who else? ADOS, New England. What's up, family? What's up to all of y'all? Happy Mother's Day. Yes. Woo, do I have a gift for you this evening? Yes, I do. Woo, come on in, start your watch parties, family. I'm going to give you guys a chance to file on in. I've got a fire letter for you guys. I've already done one show about this, but it's time to do a second show because we need 100,000 signatures on that White House petition for our specific COVID stimulus relief. This is our demand letter to President Trump with our proposal. Yes, I want you guys to follow on in. It's going to be an exceptional show. I am so proud of this body of work that we put together collectively from all over the country. It is just so awesome to align our efforts and come together for a time like now to help ADOS get some immediate relief. I'm sure you agree. Yes, indeed. We are dying disproportionately from the COVID, and it is time for some immediate relief for the American descendants of chattel slavery. Yes, it is. And this is for all of us. It doesn't matter where you are. If you're imprisoned, this is for you. If you're homeless, this is for you. This is for every ADOS. Now, you're going to hear me refer to us as Black Americans in the letter because we really want to make the distinction that this is not reparations by no stretch. That is old in the trillions, like 17 trillion on the low end, and that's a whole nother fight. So although this is a separate demand, that reparations drum, be steady. You know how we do it, family. We multitask over here. We are covering ADOS all around. The gate is up. You understand? Yes, it is. We are going hard in the paint for our beautiful families. Our children are our future. Yes, indeed. And so this is for all of us, family. All American descendants of chattel slavery. This demand right here is for us because we are past due for an advantage in this country that our ancestors built with their lives. Yes, we are. So know who you are. Know that you are loved. Know that you stand on the shoulders of ancestors who paid the price for a time such as now. And we aren't holding anything back. We're not apologizing for being self-interested. Nobody's going to shame us in making specific demands for the American descendants of chattel slavery. That time is done. No longer are we going to be expending all of our energy to save everybody else while nobody comes to rescue us when we are individually and collectively on fire, family. That's not how any of this works. We all know that we are dying disproportionately from the COVID, not because of the Twinkies, not because of the church's chicken, not because of the 40 ounce. We are dying disproportionately from the COVID due to slavery, Jim Crow, and accrued, ongoing, systemic racism, oppression, and disadvantage in the country our ancestors built with their lives. Yes, we are family. Okay? So please, no guilt here. It is time for us. We're overdue to be American descendants of slavery first. American descendants of chattel slavery first. The gate is up. Yes, it is. No apologies here. No apologies here. So I'm giving you guys a couple more seconds. I'm going to queue up my letters so I can read from them. And then if you have any questions or concerns, please put them in the chat. Okay? We're going to start with our letter to President Trump and then follow up with the proposals. Follow me and start your watch parties. Silencing everything, family. Thank you again for joining the live. This is Angela, your Nirvana, your hostess with the mostest here on the Friends of ADOS TV channel, bringing you those ADOS hot topics. And normally I'm making the case for reparations. Well, this makes that case too, but specifically, this is our response to being disproportionately killed in a disproportionate number of cases regarding COVID-19. It's independent. So today, in this particular hour together, I am making the case for the COVID-19 stimulus relief demand for American descendants of chattel slavery, otherwise referred to in this particular demand as Black Americans. Now, as usual, I'm going to be commenting in between because, I was born to talk. And I've got a lot to say about some of the talking points within the letter, within the proposal. But let me start instead with why we decided to do a separate independent demand letter for ADOS relative to the COVID. Okay. I know that there's been some questions surrounding, is this going to upstage the demand or impede on the 17 trillion demand for the reparations? And I'm here to tell you, absolutely not. There's no need to fear. These two ideals do not conflate at all in the least. Reparations is more of a long-range goal. We hope it comes sooner than later, but we know that that's a long-term kind of ideal. And COVID stimulus relief puts immediate solutions in the pockets of ADOS suffering from the COVID. Right now, solutions. So some other talking points about that as crafted by Dawn Page, founder of Concerned Black American Citizens. Shout out to Dawn and the entire team, ADOS, Triangle ADOS, over here at Friends of ADOS TV. I helped with that initiative. Antonia Edwards for ADOS New England helped. Johnny Morant out of Triangle ADOS, Nikki Harrison, Latasha, Dawood Giazan, ADOS Columbus was instrumental in helping us with the environmental portion of this demand. Thank you, Dawood. I feel like I'm missing someone. William Dickens, Triangle ADOS. Yes, it was a stellar team. And even there were members of the Friends of ADOS PAC that actually got involved in the early stages of drafting and putting this together. I'm grateful to each and every one of you, and I feel exceptionally blessed to be amongst this level of intellect, educated, bright, beautiful in every way, and just to be a part of a coalition like all of the other ADOS chapters throughout the country who are putting in work on a local level. I commend each and every one of you, and I'm just proud to be amongst you, getting this work done for the benefit of our people. So this initiative is an attempt to protect our narrative as a specific group that requires specificity in all government actions. We are weaponizing the historical ADOS advocacy groups' failures to advocate effectively or consistently for our communities. Okay? keeping reparations in the forefront and not getting lost in universal COVID-19 relief, maintaining pressure on legislators without appearing to be tone deaf to the sufferings of the greater community, forcing the CBC to make good on their promise to pass legislation already on the floor, like HR 40, with edits preferably, essentially hoping to call their bluff, wouldn't prefer a future plan to immediate COVID-19 cash disbursements for ADOS. They wouldn't prefer a future plan to immediate COVID-19 cash disbursements for ADOS. Quantification of the disparity of need by using a large number, but not too large, while attempting to remain below the figures in FHTE. For example, 250,000 per individual. Provide talking starting points with $6,000 monthly COVID-19 relief benefit cash disbursements, 60% COVID-19 housing incentive, and an option to buy into federal employees' silver health care plans. Use the impact of COVID-19 on the ADOS community to help the public humanize and better relate to how slavery and redlining creates the need for greater urgency and the need for the COVID-19 relief and reparations. You see, it's not either or, it's both and. Okay, family? So the CARES Act, last point, presents a clear example and a teachable moment of how universalism has historically excluded the Black community and transfers wealth. We attended several NAACP and Congressional Black Caucus town halls, to name a few, in advance of this initiative. And they're absolutely right. I found myself on a CBC call, and they were screening people that were dialing in. And if you said when you dialed in that you were calling about reparations and a Black agenda, they simply would not have you on the line. They skipped over you. They pretended as if they were very much open to your questions on air, but you didn't get called on if they knew that that was your question before they allowed you to speak. So these are some of the reasons why we need a COVID-19 stimulus demand right now, specifically for ADOS. So let's get into the letter to President Trump first, and then I'm going to read the proposal. And as I mentioned, I will full stop and do my comments in between for clarity for those of you who are new to the ADOS movement, CBAC, Friends of ADOS TV. If you're new to this experience, you can understand the ideas back of our demands here, okay, and the letter. Dear Mr. President, Concerned Black American Citizens, CBAC, a nonpartisan coalition advocacy group on behalf of American Descendants of Slavery, ADOS, are calling on the Trump administration to immediately establish a $2.4 trillion Phase 4 emergency COVID-19 relief stimulus for Black Americans. This emergency relief package would include monthly income, a cost of living adjustment, COLA, an adjusted monthly relief benefit, and a housing incentive of up to 60% for 24 months. On April 7th, Black Americans heard you take a pledge to investigate the disproportionate death rates from COVID-19 among us. As of April 30th, 67,300 Americans died of complications from COVID-19. At least 23,353, or 34.7%, were Black Americans. Full stop, me speaking. 34.7% is a conservative number. There are two reasons why I say that. First of all, I've never seen a report of any numbers coming out of any of the states that are reporting under 40%. And secondly, not all of the states are reporting the numbers of ADOS that are dying disproportionately in their respective states from the COVID, nor are they telling us the numbers of us that have it, the number of cases. So 34.7% is conservative. I believe it's more like 50-60% based on the numbers from the states that are reporting. But that's just a weighted average between the low number and the high number to land me around that number. All I know is that they're not telling us, and I believe it's for a reason. I believe it's for a reason that they're not sharing with us, because how hard would that be to tell us the number of ADOS cases and deaths? Not hard at all. Something is awry and amiss. But I digress. Moving on. Black Americans are dying at 3 to 4 times the rate of other ethnic groups. In fact, Dr. Anthony Fauci, NIAID director, stated the following, open quote, "We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately affecting minority communities, particularly African Americans. We're very concerned about that. It's very sad. There's nothing we can do about it right now except to give them the best possible care to avoid those complications." Full stop, me speaking. There is something we can do about it right now, and that is what this demand letter is designed to do. Something right now. Health disparities have always existed for the African American community, but here, with this crisis, is shining a bright light on how unacceptable that is, close quote, he said. After the coronavirus is gone, disparities within the Black population will persist and must be addressed. April 7th, 2020. Historically, specific circumstances have created the poverty experienced by Black Americans, and the health outcomes reflect these facts. The fact that Black Americans are dying at exponentially higher rates from coronavirus is definitive proof of the compounding effects of pre-existing health and generational poverty in the Black community. At the root of our existence is the racial wealth and income gap created by slavery, Jim Crow, redlining, mass incarceration, and job discrimination. The infection and death rates are evidence of the specific devastation and harm resulting from structural and systemic anti-Black racism against the descendants of enslaved Black Americans. Quote, "African Americans in particular are more likely to suffer from health problems that are some of the main triggers for COVID hospitalization, including asthma, diabetes, and obesity. On each one of those health conditions, African Americans are above the national average by a percentage point or more, and farther above the numbers for white, non-Hispanic Americans." Close quote, NBC News, April 12th, 2020. Misinformation about the disease, full stop, me speaking, akin to some ADOS, some Africans, and some Caribbean people saying that our melanin protected us from catching the COVID. Those were the misinformation campaigns out there that had people foolishly running around here, continuing to conduct themselves business as usual when this pandemic started, which is another reason why I believe that we're impacted disproportionately. We really didn't get on this train with masks and protecting ourselves and being tested until far after the fact, because of these misinformation campaigns out there that were trying to convince us that our melanin somehow made us a safety net, and that COVID could not impact us in the way that it's ravaging our communities to this day. Lack or denial of priority testing, full stop, me speaking. I have heard from ADOS all over the country, in particular New York City, who told me or said on the lives that they weren't being tested for the COVID until like their 3rd, 4th, or 5th visit. They were being told to go home until they could not breathe. Well, by this time, they're getting a body bag ready for you. And so how many more ADOS could have been saved and preserved from this heinous pandemic had they been tested the first time they were symptomatic? True story. In October 2017, I had all the symptoms of COVID. I had a fever that would not quit. I was coughing so much, I thought I was going to rupture a lung. I had fatigue. I had no taste for food. I had no scent for food. It was an utter and complete nightmare. And once I completed a whole bottle of Robitussin, I went to a doctor that my girlfriends recommended, and they told me, because this was in October 2017, they did not have a name for this, but I felt as if I was going to die. Akin to a lot of the people that you hear from in this country that contract the COVID, they feel like they're about to die. My doctor told me that I had, let me go back. I am a very healthy 53-year-old woman, okay? I power walk on the beaches down here in Long Beach where I live. I eat very well, have a really good diet. I incorporate a lot of green smoothies and things of this nature. I drink a ton of water, or this limeade that I love to get that alkaline in the water. I do a limeade. And for me to have to go to the doctor practically near death is very unusual. I take no additional supplements. I don't have diabetes, heart disease. I don't have high blood pressure, none of it. I'm very healthy, okay? And so for me to have to go into the doctor feeling near death was huge. So she tells me that I've got severe acute bronchitis, walking pneumonia. And all I could think of was I contracted this from the courts where I work as a litigator and negotiator. Now, why do I think I contracted it from the courts? For two reasons. Number one reason is that I work amongst immigrants. There are a lot of Asian and Hispanic immigrants in the workforce who get injured on the job. And my role is to go into the courts after their cases settle to go up against big insurance to get my doctors paid for the treatment they lean for free, okay? So if you were to get injured on the job here in Southern California, you would pretty much have to have a case to determine whether or not it was job related. And during that time, you're treating with the doctors who I represent in court, okay? But the challenge is when I'm in court, I'm not just with the immigrant workers who are there by and large for their work comp claims, waiting to be heard on their issues. I'm also around middle-class immigrants who do the same thing I do, who are able to travel to far-off places and bring back any manner of disease. And as you know, with the COVID, you could be totally asymptomatic and infect someone else. So at the time, I didn't know that it was the COVID. I'm only coming to that understanding now. So at the time, she treated me for severe acute bronchitis, walking pneumonia. I was too afraid to take the shots. She gave me a 10-day subscription of antibiotics. And then she pulled me off of my work, which is problematic also. Because in the courts, most of us are 1099 independent contractors, which means we have no benefits, okay? Obamacare was charging me $758 a month for a PPO. So I had to pay because I didn't get sick often. I chose not to give them all that money because it was that per month. Then there was a copay when I went to the doctor, and then there was $8,000 deductible if I had to be hospitalized. So because I'm otherwise healthy, I opted out of that. And so you've got a lot of people like myself in that same position, who don't have health care, who continue to work while sick. So my doctor pulled me off the job. And when we don't work, we don't get paid. We don't have paid sick leave. So I become empathetic towards people who are working in gig jobs like Uber and Lyft and Instacart and the like, because it was when I was, practically on my deathbed that I really needed superior care. Thankfully, I could afford to pay out of pocket because I wasn't giving the healthcare system, what's that? About $10,000 a year just to be covered under a PPO. So thankfully, I was able to pay. But think about the people who cannot pay out of pocket, who don't have the salaries to support paying for medical coverage as a one-off. Very dismal for those people. So I'm saying all that to say that it took 5 months with those antibiotics for me to feel well again. I was only off from work for 2 weeks and had to go back. So I wasn't even fully recovered, which means now I can infect other people around me, right? And this is what's happening. And this is why they have been ordered not to open up these states until they've got 14 days of those numbers declining. That's for a reason, because you can seem well and be in these spaces, in these restaurants, in these courts, in your workspaces, and be infecting other people. Just because you're not coughing up a lung doesn't mean you don't have the COVID. I would venture to say all of us have come into contact with the COVID, given that I can trace my incident back to 2017. I had a relapse first quarter last year. Once again, she diagnosed me as having severe acute bronchitis, walking pneumonia. And this time she gave me not only the 10-day antibiotics, she insisted I take the series of shots to the buttocks. For 3 consecutive days, I had to go to her office and get this particular shot. So because I caught it early enough, guess what, family? That thing left my system within 2 weeks, what took 5 months the first time. So when I say here, lack or denial of priority testing is what's killing us, that is what I mean. If you are sending ADOS home until they cannot breathe, you are literally killing us. You are literally killing us, especially in these bigger cities with the public housing and the pollutants, the toxic pollutants throughout the air ducts of these high-rise tenement housing structures. The fact that there's lead in the paint and lead in the water. You're telling us to go home to that, to self-quarantine, which is a COVID playground. Okay. If they were testing us early, we could have probably saved more lives. Moving on, unequal medical care and exclusion from the CARES Act have exacerbated the financial health crises. So let me read that sentence all together. Misinformation about the disease, lack or denial of priority testing, unequal medical care, and exclusion from the CARES Act. And let me add one more. Inability to social distance. That has become a privilege in this country, which is why you don't see the other groups dying disproportionate from the COVID, okay? We have to be out here still working. My mortgage company told me that they'll give me a forbearance, but they want a balloon payment. Okay, family? They want a balloon payment come June. Now, how is that going to happen when I'm no longer earning, $5,000 a month? How am I supposed to come up with a balloon payment? So I literally had to get out here and become an Instacart shopper. And thankfully, my customers were extremely generous when they tipped me. They tipped me exceptionally well. And why did I have to get out here and do that? Because out here in California, the systems weren't set up to accept my unemployment claim because I'm a 1099 independent worker. So what that meant and what it means for many of the, I think, how many of us are laid off now? I want to say around 30 million last count who have lost our jobs due to the COVID. They only had the systems designed to accept W-2 applications for unemployment insurance. And what does that mean, family? That means I could not get even the $600 additional federal stimulus because it's tied to the state. They only recently came up with a way to accept 1099 applications, gig workers, self-employed, independent contractors. They just came up with a way to honor our applications. So I was just approved, but I've been laid off since March the 16th. How in the world was I supposed to care for my daughter? How in the world was I supposed to keep up with the mortgage and keep all the other bills under some manner of control when I know I'm losing by now, what? We're in the month of May. I've lost $10,000. How in the world is everything still due and I've lost money and now have to be out here risking COVID to do Instacart shopping for very generous customers? So if this is a challenge for me, family, it is a challenge for most of us throughout this country because we are the self-employed, the sole proprietors, the 1099 independent contract workers. The majority of ADOS, that is what we've been pushed into after Uber and gig jobs took over in the era of Obama. That was allowed to improve the unemployment numbers at our expense. I'm educated and I've been working forever. I've got experience up the wazoo in various industries. So we can't blame this on the ADOS who lack education. This is not just happening to me. It's happening to many of my ilk, of my pedigree. Hence this COVID-19 demand letter. Moving on. Decades of Democratic Party's benign neglect policy, the Republican Party's Southern strategy and inheritance theft have legally redlined Black Americans into overly crowded, environmentally hazardous food deserts with poor transportation and limited access to no access to health care. The disparity of resource allocation in Black versus white communities is stark. Full stop, me speaking. I've shared with you guys many times on my previous shows that of 107 trillion household dollars, white folks share $100 trillion. Black folks share $3 trillion. And of that $3 trillion, 10% of Blacks share 2.3 trillion, while 90% of Blacks share 700 billion. Let that sink in. Of the 100% of Blacks in this country, 10% are Black immigrants. Do the math, family. Who's eating the costs of slavery? The Black immigrants or ADOS? 10% Black immigrants or 90% ADOS? Moving on. This means Black Americans will suffer disproportionately from the negative financial consequences associated with having scant resources while bearing the greatest risk to our health by leaving our homes. Or as I mentioned prior, being quarantined in our homes. in the ones that are full of pollutants and toxins in the air ducts, lead paint, and lead water that we've been redlined into by and large as ADOS. Due to our overrepresentation among hourly workforce, where we do not receive paid sick leave nor adequate or affordable health care coverage, Black communities are affected more by COVID-19, resulting in more deaths. We are largely employed in front-facing essential positions where social distancing, one of the primary protections against the virus, is reserved for the privileged and not the Black American essential worker. Our forced position at the bottom of the economic ladder dictates this dilemma. Further, in the aftermath of Obama's Great Recession, home ownership collapsed, destroying generations of accumulated wealth and inheritance. This left Black descendants of American slavery at 50% of the homeless population at the start of this newest economic calamity. Concerned Black American citizens reject Surgeon General Jerome Adams' recent admonishment that the African American community step up and stay away from alcohol, tobacco, and drugs. Full stop, me speaking. White folks, Asian folks, and Hispanic folks drink alcohol, smoke tobacco, and do drugs. This is more of the benign neglect from our government and this Surgeon General to only deal with effect of COVID and not the cause back of COVID, which is slavery, Jim Crow, and accrued ongoing systemic racism, oppression, and disadvantage in the country our ancestors built with their lives. We, as their descendants, are the legs of the table everyone else eats from. Moving on. Ironically, each of these vices are easily accessible in Black communities nationwide. There were no calls to eat fresh produce, to exercise, or pledge to eliminate food deserts. There were no promises of priority testing, nor mass N95 mask distribution. As with the 1980s crack epidemic, Black Americans are now being scapegoated for bringing death to their own communities from foreign lands they have never set foot upon. That bears repeating. As with the 1980s crack epidemic, Black Americans are now being scapegoated for bringing death to their own communities from foreign lands they have never set foot upon. Moving on. If the current death rate of a very conservative 34.7%, me speaking, among Black Americans persists, over 60,000 Black Americans will die from the COVID-19 pandemic on your watch, Mr. President. In your words, Mr. President, is your administration, quote, doing everything in its power to address this challenge, quote, close quote? Concerned Black American citizens say you are not. However, we are now hopeful that upon your review of this grave situation, you will take action where previous administrations have failed. Do you get that subtext, family? Do you get that subtext? I hope you caught that. Best regards, concerned Black American citizens. I am so proud to be amongst you. Next, let me quickly get through the proposal as not to detain your evening. It's just rich. It is just rich. Emergency COVID-19 relief for Black American descendants of chattel slavery. It has been established that Black Americans are dying at higher rates from the current COVID-19 pandemic. Explanations range from the perceived health habits of Black Americans while ignoring the role of environmental racism and employment discrimination in the health outcomes. Environmental racism is the ecological outcome that results from institutional racism and redlining. Redlining is defined as the denial of mortgage credit on properties located in certain geographic areas, even though the market value of the property is sufficient collateral and the applicant is creditworthy. Racial employment discrimination not only persists, but has not changed or declined by some estimates over a course of 25 years. While the persistent variable of racial employment discrimination has been identified as implicit bias, overt forms of racism persist in the workplace. Full stop, me speaking. Down here in LA, the new form of discrimination, as we've declined from 15 to 9%, and the Hispanic population has been encouraged to have their babies and are now at 51%, is that you have to speak Spanish even to get a job interview. And when you show up looking like me and can speak it as clearly as any native, you still don't have the complexion for the protection. Affirmative action is by and large working for white women and for immigrants. Moving on. Because of this persistence of racial employment discrimination, Black Americans who are descendants of the institution of chattel slavery are overrepresented in what is now termed essential jobs, previously referred to as service jobs. Even in the health industry, where workers are at the forefront of the COVID-19 pandemic, Black Americans represent a higher percentage of the lower paying occupations within the industry compared to our percentage in the sector altogether. Phase 4, emergency COVID-19 relief for Black Americans. For adult Black Americans with adjusted annual household incomes of less than $150,000, COVID-19 relief benefit, CRB, and COVID-19 housing incentive, CHI. Number 1, an average monthly COVID-19 relief benefit of $6,000 adjusted by regional cost of living adjustment, COLA. And number 2, a housing incentive of up to 60% of monthly housing expense, not to exceed $2,000 per month for a period of 24 months. Number 3, emergency COVID-19 health insurance benefits, CHIB, and COVID-19 hotline. A, health insurance equal to that provided to federal employees at or above the standard of a silver plan on the marketplace through the Affordable Care Act. Dental and vision should be included. This health insurance should be provided over a scope of 24 months. B, due to reports of medical facilities denying Black Americans coronavirus testing, a hotline should be established. This hotline should not only report such medical facilities, but should fast track the screening of Black Americans, whether symptomatic or asymptomatic. Number 4, monthly Center for Disease Control, CDC, reporting of the rate of testing for the coronavirus among Black Americans, infection, recovery, and death rates of Black Americans. These figures are based upon the cost of living differences across the U.S. Please see the appendix. These figures also consider discrepancies in property values between redlined and non-redlined areas, where the latter category has more favorable air quality. This proposal considers excise tax and other fees associated with metropolitan urban regions that include transport cost, higher cost and demands in water treatment, waste management, and increased energy usage. Concerned Black American citizens, an ADOS interest group, values the ideals promised in the Constitution of the United States of America that all men are created equal. We believe that these ideals can only become a reality with the moral and economic restoration of the Black family. The end. And yet, the beginning. We've attached the appendix, cost of living, New York, cost of living in Boston, references. It's just beautifully put together, family. Beautifully put together. I couldn't be more proud to have been allowed to be a part of this demand. It was an honor and a privilege, and I look forward to more collaborations of ADOS chapters throughout the country with CBAC. Rich, rich, and more rich. Thank you, Nicole, for being Nikki. Oh, we were just on a conference. This is Nicole Hairston. She is a part of Triangle ADOS, and she is on the committee to blast the emails out to all of the civically engaged churches throughout the country. Thank you so much for joining the live, Nikki. I appreciate your being on the live. Family, I'm not going to belabor since I don't see many questions or comments. I will be running this in succession. You guys know how I do. There'll be many watch parties. I'm encouraging you to share. Share. Make this go viral. We need 100,000 signatures in 30 days. On our White House petition, when the show concludes, I will attach the link to this presentation, and I'm going to run this again as a watch party upon conclusion. I want to thank you so much for getting involved with this movement, for slinging bricks wherever you are. I want to thank you for helping us spread the word and to get these signatures. I will be tweeting this to every member of the CBC, the NAACP, and the National Urban League daily. They will get the petition, the letter, and the proposal daily. And we'll see what happens. But just know that we love us Black, we love us strong. And we are doing everything in our power that all the other groups are failing to do. We are ADOS self-interested without apology, unapologetically. And with that said, family, I want to bid you a beautiful, God-inspired rest of your evening. Happy Mother's Day all around to those mothers out there, to the fathers who have to fulfill the role as mother. I want to wish you all a beautiful, happy Mother's Day. And I pray in some small way this was a gift to you, because it truly is one to me and my daughter. Just grateful to you. CBAC and Triangle ADOS, FOADOS, ADOS New England. Thank you. I'm going to say my prayer protection that the light, thank you, Moni Love. I see you, baby. I see you. That was awesome, Nicole. Yes. It's just rich. This was like Christmas. It just feels so much better, family, to be active instead of crying in our beer. Be safe, ADOS family. Absolutely. If they send you back to work, you make sure you're continuing to take your supplements, that they're plant-based, antiviral, herbal supplements, and you wear your mask when you're around a bunch of people, and that you wear your gloves, and that you carry your antibacterial hand sanitizer. Take care of yourselves and each other. Paula's back. Oh, she was here earlier. Happy Mother's Day, Paula. Happy Mother's Day to everyone. So with that said, family, the light of God surrounds us. The love of God enfolds us. The power of God protects us. And the presence of God watches over all of ADOS and its allies. Wherever we are, God truly is, because you are the face of God. You are the voice of God. You are the body temple and the living temple of the Spirit of the living God. Mwah. I love you, Black. I love you, strong. Good night, family. Mwah. Take care of yourself. Love you, Black and strong. I'm out.